Well, I think the main secret is not really a secret. It's something that we all know, are all aware of, and that's basically extreme self-care. And what I mean by that is making sure that you take the time to, eat well, rest, reduce your stress, and the most important one thing of all is exercise. If I could credit anything in terms of my productivity and ability to be engaged and my independence, is that I exercise. And that is the one thing I think that slows Parkinson's down. I mean, studies have shown that.
The one thing?
The one thing, if anyone had to make one change in their treatment and their lifestyle, I would say exercise by far. And it doesn't have to be anything special. Studies are still out as to what type and duration of exercise is the best thing to do. My policy is just move. Do whatever interests you and motivates you so that you do it consistently. Dancing, yoga, tai chi, Zumba, swimming, biking. It doesn't really matter as long as you do it consistently and you enjoy what you're doing, so you will continue to do it. My personal regimen and what I often recommend to people is if you can do cardiovascular exercise 3 times a week for 30 to 60 minutes at a time, if you can do strength training 3 times a week, and then stretch every day if possible. Have a stretching routine. Because it's like fighting a losing battle sometimes, you feel. Because you stretched well, and the next day you seem like you're starting sometimes from square one, depending on how your symptoms are. So it's an ongoing disease, and you have to have an ongoing fight to match it.
So what does your day look like?
Sorry?
What does your day look like exercise-wise?
Well, I have kids, so I have to get up early enough in order to incorporate it. So I wake up probably, before the kids at 5:30, 6 in the morning. I'm lucky enough to have a home gym. I go downstairs, I'll either throw on a video, work with kettlebells, or on the elliptical trainer, and then I'll do my stretching or yoga. I also have a personal trainer that comes in a couple of times a week to keep me motivated and moving. And that's what my day looks like. I also try and stretch out again in the evening before bedtime, because I find that it keeps me more comfortable at nighttime as well, because we all have a problem sometimes of discomfort while sleeping as well. So I find that helps.
Can I ask you about medication?
Sure.
When it comes to
medication, I'm probably on a good 20 pills a day. I take Sinemet, I take Stalevo, which is a long-acting Sinemet, I take amantadine, I take Requip, and I take Motilium. And although I'm not a big fan of medication, I'm also of the mindset that if it's going to help my quality of life, then I'll take it. Because until a cure or better treatments are found, it's all about quality of life. It's all about remaining engaged and being active and productive, and that's the goal. That should be the goal of all treatment.
Should I be afraid of levodopa? Because I'm on, like you read.
You'll read 2 schools of thoughts. Some people say to delay the levodopa in order to so that it doesn't lose its efficacy. I'm of the believer that people tend to delay taking levodopa because they're afraid of that. And really they're then left with this conundrum because their quality of life isn't ideal. Because levodopa is still one of the best medications that we have to combat the motor symptoms of Parkinson's. My feeling is more so that what happens is that the disease progresses. So your levodopa isn't, at the dose you were taking it, isn't as effective at controlling your symptoms because the disease has progressed, as opposed to the levodopa not working as well.
So to conclude, what can I do to slow down the progression? Less exercise.
Exercise, and self-care. So that, exercise is also helpful in the context of self-care in general. So maintaining your connections with other people, reducing your stress, eating well, doing what you love, remaining engaged. These are all important things for quality of life. But I think if you had to do one thing, incorporate one lifestyle intervention or make one change, it would be to exercise.